control of the disease by the physician. At of life care, goals are to help people live as well as possible. They die and they die with the dignity, and to control the pain and other symptoms which are related to terminally ill condition, and to improve the quality of life of the patient, not only for the patient but their family members and the caregivers also. So the goals can be achieved by which is most important. Number two is dyspnea, delirium, nausea and vomiting, constipation, oropharyngeal secretions, and fever. So pain is prominent symptom. To treat the pain, we usually use opioids. Among opioids, most important is morphine. But oxycodone, fentanyl, hydromorphone, they are also used. Fentanyl is available in different forms like IV, sublingual tablets, transmucosal lozenges, buccal tablets, sublingual sprays. Morphine is available in oral and injection preparations. Along with the opioids, non-opioid pain relievers like acetaminophen and NSAIDs can also be used. And here we can see this WHO ladder pattern. This I am not going to discuss. Second symptom is dyspnea. Dyspnea in the terminally ill patient can be due to respiratory and cardiac causes. And to measure the level of dyspnea, there is 0 to 16 point scale, respiratory distress observation scale, which is based on the observer's clinical assessment. For the dyspnea, opioids are the drug of choice, and if we use opioids in small and adequate amount, they do not compromise the respiratory status and do not hasten the dying process. So use low doses of opioids and at short interval. So these are the opioids which can be used like fentanyl, hydromorphone, morphine, and oxycodone. They are using for dyspnea. Number three is delirium and agitation. For controlling the delirium and agitation, antipsychotic medication like haloperidol and risperidone, they are effective. So they are used in lower doses as compared to psychiatric disorder like in schizophrenia. Benzodiazepines are equally effective due to their sedative effect. For controlling nausea and vomiting, this is also a prominent feature. The same dopaminergic antagonists like haloperidol, risperidone, metoclopramide, and prochlorperazine, they are used as first line of drugs. When first line of drugs are not helpful, then we can use a second agent. And if vomiting and pain is suspected due to malignant bowel obstruction, the medical management we can include as antiemetic like haloperidol and corticosteroid and analgesics. So these are the medications which can be used like anticholinergics, scopolamine, lorazepam, cannabinoids and corticosteroids are used as second line of drug. And this haloperidol, prochlorperazine, 5-HT3 receptor antagonist like ondansetron, it is present as mouth dissolving tablets. Next symptom is constipation. It can lead to pain, vomiting, restlessness, and delirium. Constipation can be due to lower intake of food and fluids, and it may be due to the side effect of opioids. To control the constipation, stimulant laxative like Senna with a stool softener can be used. Even stronger laxatives, suppositories, and enemas are indicated if simple stimulants are not working. To control the opioid-related constipation, US FDA has approved methylnaltrexone for the constipation. So these are the drugs which can be used. Next symptom is oropharyngeal secretions. Usually, oropharyngeal secretions are due to weakness of the muscles and they are not problematic to the patient, they are problematic to the caregivers, especially at the night time when they produce sound. So caregivers should be reassured and they should be told that these are the normal process during die and shutdown of the body. So in these conditions, the patient can be repositioned and anticholinergic medication can be used like atropine, glycopyrrolate, hyoscine and scopolamine. Coming to the next important thing, which is emotional and mental support. This was the physical support, and now mental support. Goal is to help them live as well as and die with the dignity. So, for emotional support, be present. Visit the person regularly, even if they cannot talk back, and listen to them clearly if they can talk. Provide them a physical contact, hold hands or give a gentle massage to the patient, and create a comfort mood. Use soft light and music, play a music at low volume so that they feel good. Share the old memories with the patient and talk about the feelings, how do they feel. Seek professional help. If these things doesn't work, then we can counsel the counselors, psychologists and other specialists, they can help. And next, the cognitive behavioral therapy, which is particularly beneficial during this process. Cognitive behavioral therapy is widely used as effective therapy. There are some techniques like cognitive restructuring, behavioral activation, exposure therapy, mindfulness. Next support is mental support. Involve the dying person and communicate with them. And that what they use, ask them. Provide a preparatory grief support. If sometimes there is a party or function in the family and they feel grief, so they need a grief support. Suppose the new baby come in the family, so we have to support them. Coming to the spiritual care. So there are the counselors, spiritual counselors who can counsel to the patient regarding the spirituality. Next is the compassionate care. The patient should not feel that I am patient and that he is the physician. So he should feel that he is also suffering with me. He understands my problem. In spiritual care, patient can be given some task like legacy project. Legacy project, there the patient can do some tile painting. So these things will be memorable to the next generation. And there are the if patient is having the some recipe, he can compile the book of recipe. So it can be memorable thing. So uska mind will be diverted and he will feel good. Practical support. We should support him in bathing, dressing, eating, and it will improve his or her quality of life. Advocate advanced directives like ensuring that legal documents like living wills and power of attorney are in place and they can help the patient wishes. Coming to the holistic approach, there are some complementary therapies like massage, acupuncture, aromatherapy, music therapy can enhance patient comfort and well-being. Mind-body practices like meditation, guided imagery, and gentle yoga, they can help manage stress and promote relaxation. Now, next is family support. So, family is also burdened when she is taking care of the patient. So, they should get temporary relief so that they can again do the support the patient. So, my take-home message is the dignity and comfort of the individuals in end-of-life care should prioritize. Holistic approach should be adopted, addressing the physical, emotional, and spiritual needs. There should be open and honest communication with patient and their family members. We should provide comprehensive support to the patient and their loved ones and respect the unique wishes and preferences of each individual. Advocate for quality end of life care as an essential part of the healthcare and strive to make a positive impact on the life of those who serve. Thank you so much for listening.
Thank you, Dr. Ramadan. Any questions? I have one comment to make. It's very easy to talk about others. When it comes to your own family,
Yes.